Hi everyone, welcome back to Hygiene and You. Today again we have Dr. Kiran Kukreja here. Hi doctor.
Hi, hello everybody.
I've received a few questions around white discharge and vaginal hygiene. So I thought it will be best to have the doctor answer these questions. So doctor, our first question to you today is what is white discharge and is it normal or is it not, and why do we get it?
Well, as the name itself signifies, it is normal white discharge from the cervical and vaginal glands. So that is just for the safety of the vaginal wall. It's very protective. Also, the discharge, the normal white discharge, helps in getting pregnant during sexual intercourse, because this is the media for the sperms to swim in. So this is what is normal. But if there is any infection or pre and post menstrual cycle or pregnancy, postpartum, these are some of the times when the discharge can be different. And if it's foul smelling or it's giving some symptoms like itching or bad odor or redness, swelling, that means it needs treatment. You have to take medical care. There may be some infection. It can be bacterial infection, it can be fungal, it can be protozoal, any of them.
And is the occurrence of discharge cyclical process? Because like I noticed that there are certain days in my cycle, like during ovulation, where the discharge is more, and there are certain days when there is no discharge at all.
Well, whenever the estrogen level in our body is rising, that time we can have more discharge. Like premenstrual, postmenstrual, also during the ovulation time, the discharge can be more.
What kind of smell does it have, and is there a way to differentiate that smell is normal, or is it the smell has changed? So does that mean we've got some infection?
Well, normally it is odorless and it is very transparent liquid. It can be sometimes sticky, but if it is non-odorless, that is also normal. But if there is any symptom associated with it, like itching or foul smell or redness, then definitely you can also notice the change, and it needs medical attention, because it can be because of infection.
Okay, so if we do notice any strong smell, that means it's an indication of an infection, and we should
Yes.
consult a doctor.
Sure.
Has the occurrence of discharge, has it got any association with how we maintain hygiene in our private parts?
Yes, sure. Actually, I will advise everybody to use cotton underwears, panties, because the skin here also needs to breathe, and we can't keep it tightly closed all the time. That leads to wetness and itching and infection. So also at different times of the cycle of menstruation, the discharge can be different in quantity. Normally it should not smell, but at pre and post menstrual, and also during pregnancy, also at the time of ovulation, as I said, the discharge increases. It's based on hormones in the body. Estrogen increases at these times. So the discharge is more, no problem, that is normal.
So like you said that we should wear cotton underwear.
Yeah.
And so apart from that, any other tips that you would like to share for us to maintain proper vagina hygiene?
Well, during menstruation, it is very important to do the cleaning every time you go to the washroom. Wash with water. It's not very necessary to use very many vaginal washes, because normally if your discharge is odorless and it is white, transparent, you don't need any other vaginal washes to be there all the time. You can normally wash with water and normal soap, not very strong soaps or very fragrant soaps.
Is vaginal discharge more prevalent in any particular age group?
Yes, at the time of menarche, when the girl first starts her periods, the discharge also, the glands become active in the vagina and cervix, the lining of the vagina starts thickening. like at puberty the girl is, you know, the reproductive parts are preparing for conception, you can say. So the discharge also increases. Even some newborn girls have been found to be having little discharge for some time because of the uterine estrogens the mother had. At the time of menstrual periods, before and after, the discharge is normal. At the time of pregnancy, it is normal to have more discharge, and that is also a protective mechanism to prevent any infections. Also, after the delivery, if the postpartum period, the discharge is, you know, it's called lochia. That is like blood stained white discharge, which is normal. But as you approach menopause, the estrogen level in the body goes down, and also there is atrophy of the tissues. So some ladies do face the problem of dryness, itching, and also dyspareunia, means painful sexual intercourse.
So, do women get discharge during menopause and after menopause?
No, as I just said, due to the decrease in estrogens, the white discharge actually reduces. So that's why the dryness, atrophy, itching, and this painful sexual intercourse is the common complaint. And lubricants and all jellies, people tend to use more for that, you know, to relieve the dryness. That is okay. Even estrogen ointments are there, which are normally prescribed, and it's okay to use it.
So, would you recommend any particular type of medication or lubricants to be used after menopause?
No, not regularly. If one is having any problem, only then the estrogen local applicants are advisable.
Is it normal to get white discharge during periods? Because since I started using menstrual cup, I noticed in some of my cycles that there was blood in the cup, and on the outside of the walls of the menstrual cup there was a little white discharge.
See, the menstrual flow, the blood is coming from inside the uterine cavity through the os in the cervix into the vagina. But the white discharge is due to the glands present in the cervix and the vagina. So when the menstrual blood is coming, these glands are giving the discharge, normal secretions, and the combination comes out with the blood flow. So, and also the cup is like a foreign body to the vagina, and it's a normal reaction of the vaginal wall to give more secretions. So it is normal if you have even the tampon, when taken out, you must have noticed it's very slimy when it's taken out. So that's normal discharge of vagina. It's there even with the menstrual flow. No problem with that.
Okay, thank you so much, doctor. This session was very insightful. I did not know a lot of things that you've cleared my doubt, and I hope our viewers feel the same way and most of their questions have been answered. But if you still have more questions, please feel free to comment below and we will get back to you.
Thank you so much, and take care. Take good care of yourself.